Welcome to Dental Hygiene Development. We invite you to listen along as we discuss everything dental hygiene, from personal and professional development. My name's Autumn.
And I'm Paige, and we're just two best friends discussing what we love to do. Grab your favorite Diet Coke, Diet Dr. Pepper, maybe a glass of wine, and join us as we discuss anything dental hygiene.
Hey guys, welcome back to Dental Hygiene Development. I'm Autumn and this is Paige, and we are here July already.
Woohoo!
We're halfway through the year. Oh yeah, happy birthday, Paige. We're getting close.
I know, getting old.
You know, after you get past a certain age, you're like, oh, it's my birthday.
Yeah. I don't even know how old I am.
Exactly. Like, how old am I? I have to ask Chad all the time how old I am because I don't remember. It's pretty terrible. And once you get past 30, like 30's pretty big, and then you're like...
Yeah, you're done counting that.
I mean, what we do, wait for 40 and 50, and then it's like, then I feel like
you start counting decades.
Yeah.
Yeah.
They're not even
Very
exciting
true.
anymore. But that's okay. We're still excited here, and I think this month we're going to talk a little bit about some things to make us laugh.
Yes.
Because if we don't laugh, we're going to cry.
That's right. You got to keep things lighthearted sometimes and just joke about the things that sometimes irritate the heck out of you.
Yep. Mm-hmm.
And
we all see them every day, all day.
Yeah. You're going to totally be able to relate to these. So.
Yeah. And remember, we like for y'all to follow us and like us and subscribe to our podcast so then you can comment and tell us all your funny stories.
I feel like this is a good one to comment on because there are so many random things that are really funny to hear.
And if you've been doing it a long time, I'm sure you have a ton of stories.
Yes.
And sometimes you just need to tell people because, I mean, one, it's freaking hilarious. And if you're not there, you were like, if people weren't here with me, they probably would not believe this even happened.
There's no way that actually happened. Mm-hmm. Yeah, I got one for you today. Mm-hmm.
Yeah.
Yeah. But, so I guess we titled this one Humor in Dentistry because we're literally going to talk about things that are humorous. And so I'll just kick us off with a good story. So I had this patient. It's probably been 5 years ago now, but I honestly will never forget it. So we were sitting there cleaning his teeth. He was this he seemed like a little country or, fella. And he had this huge long beard, like a Gandalf beard, like Lord of the Rings, like super beard. And he was probably late 40s, early 50s, something like that. And we were just sitting there cleaning his teeth, chit-chatting away. And next thing you know, I see a spider come out of his beard. It starts crawling across the napkin towards me.
Oh, nope.
And nope, I'm not a spider person. So I just instinctively was like, whap! I just smacked this man on the chest, okay? I mean, I didn't hit him too hard, but, I was getting that spider.
Oh, my God.
And neither one of us said anything. He kind of just looked at me like, okay. And then I literally just...
You didn't tell him what you were doing?
No, I couldn't. I was so embarrassed. I was just secondhand embarrassment of dude, you just had a spider come out of your beard. I can't imagine how that would feel if someone had to tell me that. It was so awkward. I literally just smacked him, and he looked at me kind of funny, and then I just went right on about cleaning, talking about his teeth. But honestly, I never saw him again. He's like,
She just hit me.
For no reason.
Abuse here.
I mean, he was a big fella. I'm sure it was totally fine, but I'll never forget it. And even to this day when I tell people. Did you catch the spider? Yeah, I got him.
So he was dead just laying on him?
He was dead. So I grabbed the gauze and took it and put it on my tray because I'm like, I can't believe this is happening. Gosh. But yeah, people don't believe me when I tell them that one. I'm like, no, for real. It was for real. I smacked that man. I got that spider though. It was coming for me, and it would have went somewhere on him, and I'm like, mm-mm. And I felt bad later. I'm like, what if it was his little pet buddy because it was in his beard, and I'm like,
was it big?
I mean, it was decent size. It wasn't huge, but I mean, he was definitely noticeable. But yeah, at the time it wasn't very funny, but now I look back on it, I'm like, what in the world?
Oh my God! Yeah, it's weird, and then you do things and. You just are like, just keep on going.
Yeah. Just another day in the dental office.
Yeah, exactly. And I think that we all share some common ones.
Oh my gosh, yes.
For when you first start practicing hygiene, you're like, I have to be the only ones that are seeing this crazy stuff. But the more you get out there and you say it in front of one hygienist, they'll be like, oh yeah, that happens all the time.
All the time.
And you're like, there's more than one person that's that weird in the world. Like, that literally
The majority of people are that weird.
I know. So if you ever want to find something to laugh about at work or just when you're, like, scrolling, the Dentistry Humor on Instagram, we both follow him.
He is hysterical.
He's so funny.
I mean, I laugh out loud at his videos. And it's so funny because it's all so true and relatable that you can't get enough.
Yeah. And one of the ones that I saw recently was the one that he did when patients come in and you're running behind. Like, no, it's always when you're running behind.
Yes.
So you're running behind and you go out to the waiting room, you call them out. They've been out there waiting. They may have already asked your front desk, like, how much longer is it going to be? And then your front office person comes back like, Mr. Jones wants to know how long it's going to be. And you're like, I'm literally just cleaning this room and then I'm ready, you know? And it's already been 20 minutes. And you open the room and you're like, Mr. Jones? He's like, oh, yeah, walk back. I need to use the restroom.
Like,
bro.
Sir, you could have went like 20 times since you've been sitting out here.
Like, seriously. Like, you were complaining, but now we waited 20 minutes and you want to go to the bathroom.
Sure. And they literally, like, walked past the bathroom. Like, it's right there. You had to walk past it already.
Yeah. Like, what in the world? Like,
you
just
get on
got
back
up
to the chair
and you couldn't feel it until you stood up. Like, what the heck?
Yeah. You get back there. They're like, I got to go pee. And you're like, okay, well, you're going to have to go right back up there where you were and go to the bathroom.
So now you're just sitting like, you could have been like in like a couple of podcasts ago, we were talking about how you need to have breaks so you could go to the bathroom. But now at this point, you're standing there twiddling your thumbs at the front of the office waiting for this person to now come out of the bathroom. And then they come out and they're like, hey, you're like, glad you feel better because I haven't got to go to the bathroom.
I'm glad I'm a good person because if I wasn't, I might just
say something about it. Yeah, exactly.
Yell at you or tell you, no, you can't go pee right now.
Like, you should have gone 15 minutes ago when you asked me if I was coming to get you.
So true.
Oh my gosh, these patients. They're crazy.
They just don't think about it, I guess. I don't know. But that's
Clearly
one of the
not.
things I always do, maybe because I'm aware because of what we do. But, like, if I'm at any place, I'm like, this is the first thing I do is go into the restroom and then wait or whatever. I'll check in, go to the bathroom. I'm like... Every time. Before.
But I think it's because we are, like, hyper-aware because we deal with it so often.
Right.
That we try to not be those people.
We should put, like, a giant sign in the waiting room, like, please use the restroom. Or, like,
while
a giant neon sign, restroom. Because they'll be like, where's your restroom? And you're like, it's right there.
You see that little thing on the side that has a little man and the woman? Like, you see your whole life everywhere you go.
You know, I bet it is fun to have a male hygienist because I feel like men are really good at, like, sarcastic humor. And so I feel like it would be funny to, like, work in an office with a male hygienist and, like, be able to overhear, like, some of the things they say to their patients. Like, working with the the dental humor guy, I think that would be a hoot for the day. Like,
I hope he's like that with his patients.
I hope so, too. He has to be.
Seriously. Yeah. And if you're listening to this Dentistry Humor guy, let us know because we want to have you on because you're freaking hilarious. And we would love to know if you actually, or if you're his patient or work with him, we want to know if he is that silly with his patients and the staff all the time.
I would really love to know that.
Yeah. I mean, surely he's not like obviously he's not a boring person, but he's not like walking around the office like stiff-faced or like really serious with his patients. I can't imagine that. No, he's pretty hilarious, though.
I have one of my friends, she's a hygienist, and her brother went to hygiene school, and he's always been kind of like that, too. Like, he has a really funny personality just naturally, and he went to school, he did dental hygiene, and then he went on to dental school, and he actually just graduated, but I was like, he would be the best dentist to work for. I bet they have so much fun at work. So I was glad to know that he was becoming a dentist because I'm like, he's a good guy. Like, he's got a great personality. Like, he's really good with people. And I'm like, you know, I feel like sometimes it's rare in the dental field to have a boss that you really love and get along with.
That's true. So, I can remember one of the funny things, a doctor that, well, he didn't really work for him, but remember, what was the doctor's name at Clayton State? The really old dentist that helped us.
Oh, gosh. I could not remember his name, but I, know exactly who you're talking about.
Okay, so the one thing I remember, this is hilarious. This is probably my funniest story from seeing patients in hygiene school, is he came up to give anesthetic to one of my patients, and he's just one of those I feel like the older generation of dentists, like, they're not, like, super, like, trying to make sure the patient's, like, super comfortable and numb. So when they're going to give anesthetic, they just go on in there, you know? So
Stabby.
yeah, and this was like 10 years ago on top of that. So he was old then. So he was doing the anesthesia, and the patient was literally, like, yelling, like, moaning. And I had to turn the other way because I was also holding her hand, but she was moaning, and the whole time she was, like, uncomfortable. He was going, "Sing it to me, girl. Sing it. Yeah, I hear you. I know." And I was just like... No, he did it. You know, like, I had to turn the other direction. Oh, my gosh. I can't.
What a way to handle that situation.
Yeah.
I can't even.
Y'all, something's in my eye. And probably from me thinking about that. Okay.
You get
I think
it?
you're better. Yeah.
Yeah, you got it. I can see it. You got it.
Yeah.
What a way to handle that, though. Like, that is hysterical.
Yeah.
You know, most of the time, you'd just be sitting there like, okay, this lady's, like, yelling at me, like, it's okay.
And then everybody else in the office is, like, stepping in, like, looking around the corner, like, what's going on in that room? What are they doing? And you can, like, I love that. When you're, like, down the hall from somebody and you can hear it and you're, like, looking at your patient and you're thinking, bet you that patient's thinking, what are they doing to them?
Okay, I got a good piggyback off that, too. So, our dentist, he's funny, and he has this little shark, like the fish, like a shark in the ocean.
Like a legit one?
No, it's like a little puppet shark. Okay. And so it's like just this funny joke in the office that he'll get it out and just like randomly be like, hello. Like, it is so funny. Well, he was having the conversation next door in a room next to me about the shark. And he was talking to the hygienist. He was like, yeah, you're a lady shark today. And they just kept saying it. Well, the more they said it, the harder, like, you couldn't understand the K, and it sounded like he was saying shart. And he was saying, like, lady shart. And I, like, had looked at my patient was, like, looking at me, and I was like, okay, let me explain. And I was like, we have this little office shark, like the fish. And he was like, oh. I'm like, yeah, I know what that actually sounded like. And he's like, yeah.
And he's thinking, what are they doing in the room next door? It's going to start stinking in here. Like, please, no.
Like, I need to leave.
Yeah.
It was so
Is there a stomach virus going around?
Yeah, he was like, thanks for letting me in on that one. I'm like, yeah, you're welcome. But it was so funny. I'm like, and that happens, I feel like, often too, where you're like, okay, let me explain. Like, they're fine. Like,
everything is fine next door. I know they're talking some weird stuff, and you're probably wanting to, like, jump up out of this chair. But that's the thing, because you can hear all of a sudden they'll be quiet, and all you hear is, like, water and suction. Yeah. You may hear, a hand's piece, and then all of a sudden you hear some, like, random patient, like, call out some craziness, and you're like, they start cussing.
Oh, my gosh.
And you're like,
screaming and hooting and hollering.
And then you just, like, slowly close the door, like, so they don't hear. And you're, like, trying to act like you're just, like, looking at that patient in front of you, like, nothing's going on.
It's fine.
Like, and they're, they're thinking, like, we're going to pretend like it's not happening, like, that's going on behind us.
I feel like you do that, too, when patients are, like, choking, like, on water or their saliva or whatever. You're just like, it's fine. They're fine.
Yeah, because then when people when they start coughing or making crazy noise or, like, they're gagging, everybody in the office is wondering what's going on. So then you have, like, 5 people, like, dental assistants, like, sticking their head.
Dude.
Or coming around, and you're just, like, and you're trying not to laugh at this person, and you're like...
Oh, man. I think the hardest one I had this child patient... He and his mother told me, like, when we got in there, she was like, it's totally fine, but when he's at the dentist, he just likes to howl. Like, he just likes to howl. It just, like, makes him feel better. And so the whole time, he howled like a wolf. I mean, he was like, hoo, hoo. And I'm, like, trying to clean his teeth, and I'm really trying to, like, I'm like, okay, this is his thing. Like, this is cool, like, this is a jam, like, you go, Wolfie. And I was trying not to laugh at him, but all the people in the office, like, they just kept coming by, and they're like, and then afterwards, like, what was going on? And they're like, it's just his thing, like, he wants to howl at the dentist, like, it makes him feel less anxious, and so he's just howling. I'm like, he's fine, like, he's not hurting, whatever, like, this is a thing that helps him. But it was so funny just watching everybody come by, like, what are you doing to him? Because literally the whole 30 minutes, he's just, hoo!
How long ago was that?
Oh, that was this past year, like this year.
I was thinking, I'm like, I wonder how old that person is now, like if they're still
Oh,
howling.
gosh.
Like how old they're going to be, like when they're still howling at the dentist office.
That would be great if you did that into adulthood. He would be like my favorite patient. Like, dude, I gotta put some wolf pictures on the TV for you or something. Like, yeah, but
And you just kind of act like it's not even happening. You're just like, it's normal.
like, it's fine.
Everything's fine in here.
Again,
No worries.
another day at the dentist.
I had an assistant. She was so funny, and she'd always say that. We'd laugh. Like, any crazy patients that would come in and have, like, crazy stories, like, my dog ate my denture, or, like, something, and she'd be like, yeah, that happens all the time. Or they'd start telling crazy stories about my husband is sleeping with my mama, and, like, all kinds of crazy, like, just the randomest stories. She'd be like, yeah, that happens all the time. It's great. It's fine. And they're like, really? She's like, yeah, all the time.
I can't.
Like, okay, Mariah, like.
And you do have to do that a lot. People will be telling you the craziest stories, and you have to be like, oh, okay, cool. Or, like, you're, like, giving them advice, like therapy, you know, and you're like,
so
I'm really
normal.
I'm a dental hygienist. I did not go to school for, like, all this
I'm
mental.
just trying to clean your teeth.
Yeah, but if you need to talk about it, go ahead.
And they're all the time, like, when they come into my room, you always know it's going to be a funny appointment if they come into your room and they take their shoes off before they get into your chair.
Oh, my gosh. Yes.
I'm like, okay, first of all, do you think you're going to make my chair dirty? One. Also, do you just do it because you're just trying to get comfortable? Like, I'm never going to ask why. You're just, again, you're just like, yeah, that's normal. Everybody does it, which everybody does kind of, like, there's a bunch of people who do it.
There's more than you think that
Yeah.
take their shoes off when they come in, which it's interesting to me. I've never gotten it because I'm like, you're only here for, like, you know, you're not here that long. Like, why would you take your shoes off? And I'm like, you know, it's summertime. You're wearing tennis shoes. Your feet probably stink. You know, you take your shoes off. I would not want to take mine off. But
Or they
guess
take
they
off
each
their
their
shoes
own.
and they're barefoot
yes,
on the thing. I'm like, do you know how people sit here every day? But the funny thing, like, we wipe it down. So it's not like
Yeah.
it's dirty. Like, you wipe it between every patient. But I think that people would just be more hyper vigilant about, like, germs and stuff, especially now in COVID. They did change their mind. They still take their shoes off, but they're nasty, like, sweaty, like,
people think they're at the
barefoot
spa at the
on
dentist.
yeah.
They want to take their shoes off. They need their neck pillow. They need their warm towels. I mean, they need their lights and
understand there's
sunglasses
some-
and essential oil. I mean, I'm like, what is this?
No, that's nice. I will say that I
like
went into operatory recently, and it was in another state, and I walked into another hygienist room, and she had all the lights off. She had, like, neon signs, like that were, like, of a tooth, and, like, everything was uplighted from underneath her counter.
That's
and
cool.
she had essential oils going, and I'm like, okay. She, like, had a little dish full of mints, and she had succulents growing in the window. I'm like, okay, that's pretty cool.
Can I move in?
Yeah, exactly. Like, but if I did that, I feel like you would literally be opening it up to patients to be more, like, sticking around.
Yes. Well, I feel like some people hate, you know, don't like essential oils or strong smells. Like, we've had patients complain about that. I'm like, you know.
And they try to say they're allergic, and you're like,
Yeah.
this is natural.
Right.
Like, this isn't the stuff. This one guy told me he's allergic to everything. He can't burn candles. I'm like, this is not the same. But whatever. Like, you just
Never
don't
heard of
argue
that.
with them. Like, I
You're
just,
like, oh, okay.
sure, let me turn it off because I ain't got time to argue with you. But people love to come in and just get comfortable and tell you their whole life story. And
Which we appreciate that you're comfortable enough with us to do that. But sometimes, if we're in a hurry, you're like,
or they try to tell you their whole life story with your hand in their mouth.
yeah.
And you're like, ow, ow. Like, you have to keep taking out. And then you're like, are they not getting the fact that I'm, like, trying to get through, like, I'm putting my hand back into your mouth, like, we're done talking now. So I'm going to put my hand in your mouth. And you can't, but then they're just like, and you're like, uh-huh.
I have had a lady do that. Like, she did not care that I had a sharp instrument in her mouth. She would, like, literally talk the whole time. I had to go tell the doctor. I was like, I've never had a patient like that, for, like, set on talking the entire time. I was like, like cleaning between, like, vowel sounds or whatever. I'm like, oh my gosh, this is crazy.
Yeah, there's one of those patients that you have to be like, okay, so I know this one's going to take me longer than normal, so
Yes.
let's go ahead and put you at the end of my day, or, like, long enough. And that
Sometimes I'll go get the Cavitron because it's harder to talk with the water in your mouth. So I'll be like,
I'll teach you.
I'm about to pull out that Cavitron.
I got time for this no more.
Yeah.
And then they're like, then you have to go tell the doctor, like, this one's a talker.
Uh-huh.
Like, give him a heads up.
Yeah.
Because then the doctor gets mad because they're like, oh my God, They're looking at you and you're like,
why you tell me I was being there for 30
I'm
minutes?
like, I know. I've had to sit here and listen to it too. So I needed to take a bathroom break and get something to drink. So I decided to throw them out on you.
Oh my gosh, I know. It really blows my mind sometimes. Like, when I first started, I'd just be like, what? What is this?
And now you're not even surprised anymore.
Yeah, not even phased. It's just like, okay, well, this is what it is.
Yeah, and you had the person that's like, they won't swallow their own saliva.
Oh my gosh, yes, all the time. And it's funny because I can kind of be like that. And I think it's so funny. I like make fun of myself. I'm like, I know this is so stupid because it's my saliva. I swallow it all day, but swallowing it in the dental chair, I don't know. It's like a mental block for a lot of people.
Yeah, they look at you and like you're in between something, and then they're like,
you're like, oh, that's like, a really good. You're a fish. That's a good impression. I like this. You're really good at dictionary.
They're like pointing at it, like, and you've already taken your gloves off, and you're like,
yep.
Okay, hold on just a second. Let me go put my gloves back on. And then you're like, it's okay, there's nothing. And you can say in there, there's nothing in there that's going to hurt you. You can swallow. And they're just like, oh.
Yeah.
Like, what do you do every day of your life? Do you spit everything? No. You swallow during the day. Yes. But you just insist on spitting into my suction and taking up another 30 minutes of my day.
The worst to me is the people who, like, gather their spit to spit. They won't let you just stick the suction in there and close on it. Oh, my gosh. I have to, like, look away. I can't handle it.
And they're
I'm like, yes.
And you're like,
I never knew there were so many different ways to suction. I'm like, open and close. And you say that to your patient. You're like, okay, close, open. And then
you have to say open because they'll be like,
yes. It's like, don't you know to open your mouth back up? Like, and then they make you do it the whole appointment. They don't open their mouth until you say open. You're like, I even tell patients, like, you know, each time we suction, I've said that, and they still just doesn't register. They're just like, open.
Oh, you have to wait for my approval to close and open.
Yes.
Like, what do you do every day of your life? Do you have someone approving you to do every motion? I don't know. It is crazy the things that patients, like, they just do, and you don't even think of it.
It is so hysterical. Yeah, it's like things you don't even think of. Like, the one that gets me all the time, and I get irritated at this one, but, like, I'll tell the patient, I'm like, hey, will you turn to your right, you know, look towards me. And they literally take their head off the pillow and move their whole body to the left and then look to the right. So they're literally, like, falling off of the headrest. And you're like, you just moved further away from me. The whole point was so that I could see better and get a little bit closer to those teeth. And I'm like, why do you think that was practical? Like, just turn your head to the right. It's super easy. But then they have to, like, get up and, like, move over and...
Their head isn't on the axis, so they can just go back and forth.
Bubble or something. I don't know.
We're going to be.
Yeah, but then your mouth. Then you have to say, like, oh, you almost fall off the headrest there. You got to come back to me a little bit. And they're like, oh. You're like,
come on now.
Yeah, or you'll say that, like, hey, turn your head to the right. And they're like, okay, just a little bit more.
And you finally, you're like,
yeah.
You have to move it further.
Yes, absolutely. I'm like,
you're like, open bigger. Nope. Yep. Nope. Turn this way.
Relax your chin.
I'm gonna hold on.
God forbid you say relax your lip, because then they're gonna like bite down on that even further.
Or bite your lip, and then you're like, nope. Move your tongue. Nope.
Oh my gosh! I told a patient the other day. She's like, am I doing right with my tongue? And I was like, no, you're actually doing a really good job. I was like, it's fine where it is. And I was like, you'd be surprised. I'm like, we're professional tongue wrestlers.
When they're
and
strong.
She started laughing. I was like, but I'm being for real. Like, we literally are tongue wrestlers sometimes.
And you don't realize that, too. Like, I feel like the strongest things in your body, and you don't even know, is your tongue and this bottom lip right here. You're like, I just pull it down.
I know. I feel like it has to hurt sometimes. And I'm like, why don't you just relax? It'd be super easy.
Yeah, I could literally just get right in there. I know. Just open the right way and put your tongue back, and I can get those lower anteriors without having to pull on your chin, your cheek that much.
But I feel like those people who are like hard with their tongue, hard with their lips, they're the ones that don't open. Like, it's like all the things at one time, and you're just like, what do you expect me to do with this? You're like, I mean, looks like
they do weird things with their mouth, and you're like, have you ever gone to the dentist before in your life, or is this the first time? Because clearly this has to be
like
it.
We need an instructional video on how to open your mouth.
Like,
do not do these things.
They should teach you, like, maybe they should start giving classes to, like, kids when they start going pediatric dentistry. They can start doing it, and before you can leave and go to a grown-up dentist, you have to know how to open your mouth the right way and turn your head the right way. Maybe we'll make a class.
Maybe that should be our next CE course.
Our next CE
that
course.
hygienists can actually, like, share with their patients.
Like
a
roll it
free,
on their...
like, I don't know.
A tutorial
Yes.
on how to act at the dentist.
Yeah, you just save it on your desktop and play it while you're, like...
When they first
in
get
the waiting
there.
room.
Yeah, it's like when you get on a plane. You have to watch the safety video before we start. That's what we're going to do.
I
I'm
love
going to
it.
sit you in your chair, and we're going to watch this
Be like
video.
a flight attendant. If you could open your safety manual.
If you can do the seat in front of you, please
That's
keep
actually
your
a great
please
idea.
keep your chair to an upright position. Like there. Oh yeah, we got to do that.
This is good. Yeah. Mm-hmm. We got to do some kind of
Genius.
funny video about that.
Yeah.
That would be really good.
Or the ones that are like super like ow, ow, and they start like freaking out, and you're like, I literally just put my mirror in your mouth. Like
Yes.
I didn't touch you at all.
I have actually tested this theory before, like on purpose, like was not touching the patient, like literally was hovering the mirror like in the middle, like not touching anything, and they were like, ah! And I'm like, okay, I'm not hurting them because I purposefully was not touching them. I just put my mirror right in the middle, wasn't even touching the tongue, and they were still jumping and screaming, and I was just like, it's just their anxiety, like it's just mental.
Oh, I tell them.
Like
When they act like that, I tell them. I said, you need to relax a little bit. I didn't even touch you. It's your mind that's getting you.
mm-hmm.
I tell them that every time because it's the truth. Like, it's their
It
mind.
is. It really is.
But it's funny, though.
It is hysterical because you're just like, it's as real as if you did poke them, and you're just like, you have to know I didn't touch you.
Yeah, and then they go up front and they're like, oh, I had the worst appointment ever.
How did it go today? And they're like, oh,
It hurt.
so terrible.
And then you're like walking behind them.
I didn't even touch you.
Yeah, like rolling your eyes and looking at the front desk like, and then they leave and you're like, I didn't even freaking touch them. Like it was super easy. They just wanted something to cry about. Like it's the worst. But
is so
we
funny.
still do it every day.
That's right.
And like I said, if we weren't laughing, we'd be crying about
That's
all the
right.
things that we had to deal with. So you have to look at it in a great way. Like you have to have a good attitude about it and just laugh it off.
I think they should have this course in hygiene school, like
To prepare you for all the crazy things that you might see.
yes. But I guess
still don't
maybe
think it would be long enough. Like I think like we're always going to encounter something crazy,
that's right. Something new.
something new every.
Yeah.
all
I'm
the
really
time.
excited to see what you guys have encountered also because
Yeah,
we
yeah,
believe
definitely share
that-
it with us. If you got a video, that's even better because those things are
Absolutely.
hilarious.
Oh my gosh, so
Share it
funny.
with us. Share us your TikTok stories that you find about going to the dentist
Yeah.
or your patients that you make, because those literally, like, I could just sit there and make you
Yes.
like laugh all day.
I feel like they make our day. Like we send each other like in Messenger like funny ones that we see, and
Mm-hmm.
it just makes your day. You're like, okay, this gave me a good chuckle in the middle of my crazy day,
Mm-hmm.
and makes things lighthearted and fun. So
It's funny because it's true.
yes, absolutely. I think
happens
that's the
all the
best
time.
part.
Yep. So definitely share your stories with us. We
Yep.
want to laugh. Share your videos. Again, check out Dentistry Humor.
Yep, he's awesome.
He's funny. And if you're watching this Dentistry Humor guy, like call us because we
Yes.
need you here to be on a podcast with us to like
Absolutely.
to hang
and
out.
we greatly appreciate you and the humor
that you bring to this.
Absolutely. You have made our careers a little longer.
Yeah, absolutely. We're probably some of the ones that are sharing your stuff back and forth on
Absolutely.
Instagram.
Absolutely.
Yep. All right, guys. Well, I hope you enjoyed the laugh with us. And
Yes.
like we said, always like subscribe so you don't miss any of our podcasts. Make sure you like it and make sure you share and comment
Yes.
all your stories so we can all laugh together.
Yep.
So when you feel like crying, we can laugh instead.
Absolutely.
Yep. All right, guys.
All right.
We'll see you next time.
Bye.
Bye.